He was diagnosed with non-ketotic hyperglycemia, which is NKH for short. He was in a coma for 14 days. Children that make it out of the coma and actually survive, they usually have seizures, low muscle tone, different degrees of mental problems. We just wanted Trell to have the best quality of life while he was with us. So it just seemed only natural to come here. Started off when Trell was 6 months old. We drove 3 days a week. Logan's worked 1 to 2 jobs at a time just to make sure that Trell does get to therapy and just that he has definitely the best life that we can provide.
For Cardinal Hill therapists, the challenge was to learn about NKH and to determine proper therapies.
I looked it up online and there was not a whole lot of positive information about it. So I just waited till the parents got there and did the eval and did a lot of parent interview about how rare is this, what am I looking at, what's his future supposed to look like.
No therapy plan is ever made without assessing the condition and the needs of the patient.
The first thing I started with was trying to give him some head control because that would help with feeding and it would help with rolling and it would help with sitting and all that. And told Mom and Dad to start carrying him facing outward so that he had to work a little bit rather than cradling him because he didn't have to work his head at all. And by Thursday, his first visit, he was able to lay on his belly and turn his head from side to side.
Our main focus was on positioning so that he could eat more efficiently and start advancing his diet away from just bottle foods. They did a swallow study to make sure he was safe. And we started with some soft foods and have worked our way up, and he eats goldfish, chips, mashed up table foods. He is now able to drink from a straw.
Trell's therapists are working to increase his independence. They want him to be able to communicate his wants and needs. They want him to be able to use his hands to reach and grasp objects.
Once he started picking between picture symbols to ask for toys, ask for music, ask for food even, he gets a huge smile on his face. It's the best thing you've ever seen, huge smile. And we make a big deal, we clap and yell and yay, Trell, good job. And it just lights him up.
We're working on more independence with play, using his hands. So working on control of picking something up, to play with it, to throw a ball, to play with toys, and to work on some self-help skills.
I just want to get him a little bit steadier with walking because right now he has to wear a helmet to truly be safe, and he doesn't like the helmet, so he doesn't wear it very much.
Trell has been coming to Cardinal Hill for 3 years and has made progress that wouldn't be possible without his parents.
The biggest piece is just Kelly and Logan. They're so fabulous. They do everything we've ever told them.
Maybe some people would think we might push him a little hard, but nothing comes easy.
And they follow through with what we're doing. Set up his environment at home so that it's safe for him, so that he can explore and move around safely.
So we want Trell to be normal, and we want Trell to be able to do the things that his brother Tice does, and we want all this stuff, and it comes harder for Trell.
He's probably the biggest success that we hear about with NKH. He can get up from the floor, walk to what he wants, get what he wants, turn around, come back, and sit back down.
I think that it's only right to say thank you not only to everybody at Cardinal Hill, because we know that if we didn't have Cardinal Hill, Trell wouldn't be alive today. And with that being said, if we didn't have the great team of support that we have at home, we would not be able to do it. It takes a village to raise a child, and we have a great village.